Island, and that is normal. I keep reminding everybody to take a breath. And we're going to get through this, but I don't know how long it'll be. I'm going to be very honest with you at every step of the way. This is months, not weeks. Relative to other states, Rhode Island is faring quite well. But just try to do whatever you can to take care of one another. In a snowstorm, I ask you to knock on the door of your neighbor or check in on someone who's elderly. Today, I'm asking you to pick up the phone and do that. You know, we want to limit social interaction, but shoot somebody a text. How you doing? Can I do anything to help you? Call an elderly person who you know. Ask them if they're getting the food and medical help that they need. Mental health, we're overrun with mental health requests. This is a depressing time. It's an anxious-filled time. Unemployment is going to go up. We're going to get through it. We have a great team in place and a plan in place, but I'm asking you to think longer term, put in place your family infrastructure to get you through for a couple months more than a couple weeks. I will say this, the outpouring from the community is fantastic. I know some bakeries and cafes are giving away free bread and free coffee. Thank you. Thank you, thank you, thank you. I'm announcing right now that Bradford Soap, which is a local soap manufacturer in West Warwick, Rhode Island, is donating 70,000 bars of soap to the people of Rhode Island, and they'll be distributing that through the Rhode Island Food Bank and Family Service RI. The Catholic Diocese of Rhode Island is distributing Stop and Shop cards, gift cards to parishioners. So take advantage of that. If you need a gift card, if money's tight or money's going to get tight, go ahead and do that. I announced yesterday the Rhode Island Foundation and the United Way have come together to create a philanthropic fund. I've been hitting the phones asking folks to donate. I want to say thank you to those who've donated, and I want to urge any individual or corporation who is in a position to make a contribution, contribute to that fund. That money's going to be directed to the most vulnerable in Rhode Island. I would say, generally, this crisis is hitting the folks getting hit the hardest are the ones who can least afford to take the hit. So it's on all of us, if we're in a position to be helpful, financially or otherwise, to lend a hand to somebody else, because that's the only way we're going to get through it. And to those of you who have heard me ask for help and who have answered, I want to say thank you. And that includes companies. Yesterday I did a TV program. I said that we needed swabs, and Becton Dickinson called us and said, we're sending you 1,000 swabs. So thank you for doing that, and to all the corporate actors who are reaching out, I want to say thank you. So with that, I'm going to turn it over to Dr. Nicole Alexander Scott. She's my hero. She's our hero. She's going to take us through the update on the health care side of things. Then we're going to do a little something different here in an effort to practice what we preach. We're asking any members of the press who want to send us your questions rather than coming in person to do that. So the first question she's going to take are going to be the ones that came in that way. And then we'll stay here as long as you need to answer all of your questions. Thank you.
Good afternoon. Thank you, Governor. You are certainly my hero as well. Indeed. So I also want to extend gratitude to Commissioner Infante Green, her entire team at the Rhode Island Department of Education, and all the staff and faculty at all the schools throughout the state. The work that you are doing for remote distance learning, it's a lot, but it will make a difference. So it is appreciated. I also want to thank all the parents and families throughout the state who are making tremendous sacrifices right now. Please know that these sacrifices will have a positive impact, not only for you, but for all Rhode Islanders. Your partnership is critical as we work as a state together to manage this situation. As the governor said, we have a number of new cases. We have 10 new cases since our media briefing yesterday. That brings our case count to 33. These people range in age from their 20s to their 70s. 7 of these individuals are females, and 3 of them are males. These individuals have traveled to a number of locations, including Iceland, Amsterdam, Spain, England, and France. Of these 10 new cases, 4 of them are individuals who are hospitalized, and we expect that one of these 4 individuals who is currently hospitalized will be discharged today. The others are recovering at home. This is an important component to be able to share how valuable the public health tool of containment and contact tracing is. Having these individuals understanding what their risks are, being able to work with their families, ensuring the quarantining that's needed, are critical tools to helping us control this, knowing that the virus spreads when there is an ability to transfer it to someone else. If we can get our hands wrapped around that and protect that from happening, that makes a difference. Another announcement I want to make is that we have made an adjustment to some of our healthcare provider licensing practices in response to this epidemic. If someone holds a valid license in good standing in another state, that person will be able to get a 90-day temporary license to practice in Rhode Island. They just need to fill out the form and get it to us. Usually, this takes roughly a month to go through the application and approval process for a new license. Now, it will take a day or 2 to get through this new process to grant these temporary licenses to people who already hold valid licenses in other states. This pertains to physicians, advanced practice registered nurses, mental health counselors, pharmacists, and many other health professionals. This temporary license can be renewed one time, and there will be no cost to obtain the license or for the one-time renewal. Another thing that we are doing is extending the expiration date for any of the health professionals we have whose license is set to expire in the next 90 days. What we're doing here is continuing to stay a step ahead. We know that in the future, having healthcare professionals who are able to practice in Rhode Island will be helpful. And this gives us the opportunity to add flexibility and allowing us to plan for what we will need. I just want to take a moment also to reiterate something that we said yesterday about oral health care. Dental offices are available only for emergencies. Anyone with a dental emergency should call their dentist first. In many cases, problems can be addressed over the phone. If you have an appointment for anything less than an emergency, you should not go. We are grateful for the dental offices that can manage dental emergencies to prevent people from having to go to the emergency department with dental problems. That is a critical assistance here. Finally, we're getting a lot of questions at the Rhode Island Department of Health on a lot of topics, but the most common questions yesterday were about gyms. We are urging gyms to close right now. Most have already done so, but we want to be clear that we are strongly recommending that gyms close right now. As we have been saying for several days now, avoiding non-essential crowds, such as what occurs in a gym, is critical. Going to the gym is not essential at this time. We encourage people to be creative on ways to continue to get the exercise they need while staying local. Barbershops and hair salons are another one we're getting questions about. We're not recommending across the board that barbershops and hair salons close because they are usually less crowded. However, we are asking people to exercise good judgment, as the governor has often said. If you go and there is a large crowd, knowing how the virus spreads, we need you to turn around and go back home. We're asking barbershops and hair salons to keep their numbers low. When in doubt, just stay home. If you are sick with symptoms, you absolutely should stay home and recover safely there while calling your healthcare provider if you have concerns that there's severe illness. We are working very closely with our healthcare provider community. There are challenges right now that we are working with them to address. So we want to make sure that the public has the information they need for how to care for themselves at home if they need to. We are asking everyone to sacrifice and think about the health and well-being of Rhode Island as a community right now. And as the governor has stated, we will get through this together. So I want to start with the questions that we have received. There are two questions that I will start with for the governor, and then I have a number of questions directed to me, and then I will share the question for Commissioner Infante Green. The two for the governor are, should truck tolls be suspended, and is the governor following President Trump's suggestions that states secure their own medical equipment like ventilators and ICU beds?
Okay, so the first question, should truck tolls be suspended? No, they should not be suspended. This is a necessary revenue stream for the state, which will enable us to continue to maintain our infrastructure in Rhode Island so people can drive safely on our roads. Second question, am I heeding the president's suggestion to secure our own medical equipment? Yes, of course, absolutely. You know, it's not like we're sitting around not doing anything. We have tapped into every possible private sector vendor. You know, I have been on the phone myself, certainly, with the CEOs of all the major companies in Rhode Island, reaching out in every way that we can. Our hospitals are doing their best to purchase from their traditional suppliers. But the truth of the matter is the federal government needs to step up more, and step up more urgently. Today, we've been working very hard to have additional access to Rhode Island's stockpile of personal protective equipment. I believe that we're going to be successful in doing that. So, you know, rest assured, we are leaving no stone unturned and trying to purchase swabs, masks, gloves, respirators in any way that we can possibly get our hands on them. And again, I want to thank Senators Reid and Whitehouse, Congressman Langevin and Cicilline, because they are doing the same to help us. You have questions?
I'll continue. Yeah, I have a few if you want to sit down. Thank you, Governor. So I'm going to go through a number of the other questions. Thank you to the reporters who have sent them in. So the first is from Lynn Arditi, Publix Radio. Is the state considering lifting any licensing requirements for hospital facilities or staffing to meet a surge in needs for beds or staffing? So that was perfect timing, Lynn, because it's exactly what I just shared as an example of the types of assessments we are making to see where we can remove any barriers that are needed for beds or for staffing up for our healthcare professionals and healthcare facilities. The next question is from Jordan, ABC6. Mass General Hospital says the number of patients believed to have COVID-19 has quadrupled between Monday and Tuesday. Are there concerns about a surge of patients in Rhode Island? Thank you, Jordan. We know from day to day that we will have a variety of new cases that are identified. We want to continue to prioritize the groups that we mentioned while we're focusing on the supply resources that we have right now. That's hospitalized patients, healthcare workers, including EMS, and nursing home residents or those from congregate settings. With each day, we will continue to assess whether or not we have numbers like we did overnight versus smaller numbers. But the key element, no matter what, is to continue the containment process, the core public health tool of being able to do the contact tracing and quarantining where it's needed, while continuing to encourage everyone to avoid non-essential crowds. The next question from Jordan is, where does state responsibility for medical equipment end and hospital responsibility begin?
We'll give you two, too. I'll even give you three. I'll give you three.
So the state responsibility for medical equipment and hospital responsibility is a fluid approach. As the governor mentioned, we want to have all elements tapped into for getting the equipment. We are working on this together with states, between states and hospitals. The next question is from Bill Bartholomew. Is there an approximate working number of people who have demonstrated symptoms of COVID-19, but due to lack of swabs, have not been able to be tested? That's an excellent question that we, along with other states, are addressing. Because of the supply element right now, we want to focus on the prioritized group and make sure that anyone else who has symptoms that are consistent, given our community spread of COVID-19, that they're able to follow the same treatment recommendations that we have been saying, which is staying at home and recovering safely there and communicating with your healthcare provider if there are concerns beyond that.
Nicole,
The next
why don't
question.
we take a couple from the audience and then come back?
Okay.
Doctor, to follow up on an issue that you raised in this briefing, how concerning is it to you that there's been a jump of 10 cases in a day here in Rhode Island? And should we be concerned?
These are the types of changes that we have anticipated. We're seeing exponential increases in states across the country. We know that Mass has a large number of patients, more than what we have currently. Yes, people should heed our recommendations. That's why we're telling you about this. This is not an overreaction. This is information that should be taken seriously. If we're saying to stay home if you are ill and not go out, that is critical. We're saying to avoid non-essential crowds, that is critical. We will continue to see the types of numbers that we have seen, but the more people can heed the requirements that we are recommending and asking for, the better off we can be in the long
We
term.
haven't seen these kind of numbers, right? We haven't had 10.
We've had increases of percentage that are similar. So as our numbers grow, our testing has expanded. This is what we are anticipating.
I have a question for the governor and why we don't have a Hispanic translator? They remove it from there. We have money for sound system, we have money for TV at the state house, but we don't have money for a translator.
We're working with you, right?
No. You're not working with me. We had it for a couple of days and you guys removed the Latino translator. We need it. We're delaying the information to the community.
Yeah, you're
Why?
right. I don't know why, but we'll fix it.
Well, we have to fix it.
We will.
Thank you.
The next,
What is the state doing to respond to the effect that this crisis will have on revenue?
Yeah. So, I want to address Steve's question also. The answer to, we have 10 cases overnight, which seems like a lot. One night, 10 cases. We're not even a little surprised. So this is going to grow, right? People should not be surprised. Yesterday we were ranked as #1 in the country for how aggressively we are approaching this. But there will be more cases. It wouldn't be a surprise if we get up tomorrow and say there's another 10 cases. Hopefully there won't be. There could be another 20. So everything we're doing now, there's nothing we could do to stop it dead in its tracks such that there's not going to be any more cases. Everything we're doing is to try to slow the rate of growth. And, even in places like South Korea, where they've done a very good job of social distancing, they've been incredibly aggressive, there's still more cases. So I say that because I don't want the people of Rhode Island to be alarmed when we announce 10 more cases. It's exactly, it's what we thought, which is why, by the way, we're taking such radical steps. We wouldn't be canceling school and shutting down the economy unless we thought that were absolutely 100% necessary. So what we're doing all day in consultation with experts is looking at the models to try to figure out what does the ramp look like. And then, truthfully, the reason we're trying to buy ourselves time is to ready the system for the cases. If you have 1,000 cases over 6 months, and I'm making up random numbers here, for example, 1,000 cases over 6 months, that's obviously much more manageable for the hospitals and the ERs and our whole system than 1,000 cases in a week. So, no, we're not surprised. We're still ahead of it. As the doctor said, we're still a step ahead, and we need to do everything we can to stay ahead of the virus so it doesn't overtake us. As to state revenue, I've been on the phone, obviously, with my fellow governors. I've had conversations with Treasury and our congressional delegation. Our state revenue is going to take a serious hit. We have shut down the casino. That's our third largest source of revenue. Restaurants are essentially all closed. Unemployment insurance claims, as I said before, are ratcheting up at a rate that we've never seen. So what I'm doing now is trying to figure out, number one, try to assess how bad it will be. And number two, try to line up liquidity for the state, cash, short-term cash. Obviously, if the federal government decides to extend the April 15th tax deadline, that will create a challenge for us because our tax deadline is tied to that. So I don't have an answer for you, but it's something. We're working a lot of things right now. We have a lot of balls in the air. A whole work stream is the fiscal consequences for the state and balancing the fact that the state needs its money to continue running because we are quite literally providing life-saving services to the people of Rhode Island.
To follow up on that, if I might, just to follow up on that for a second.
Follow up.
Some in the restaurant and hospitality industry have suggested, have you given any thought to suspending the restaurant tax, the dining out tax?
The sales tax that's due Friday?
No, on a restaurant.
I think the question we're getting a lot of is restaurants and bars remit their sales tax to the state once a month, and that deadline is Friday. And we are not going to change that deadline. This is money, this is the sales tax that they collect. If you go out to, to a bar, there's a sales tax, they collect it. They hold that money in escrow, that's the state's money, and so that ought to be remitted on Friday. Having said that, the whole world is upside down right now. I have a lot of sympathy for what restaurant and bar owners are going through. Some of them might not even be able to reach their accountant by Friday. So on a case-by-case basis, call the Department of Revenue and we'll work through it with you and give you some leniency if we think it's necessary.
Brian?
Dr. Scott, given that 4 of the new cases, those people are hospitalized, are you seeing more serious symptoms, or is it just that the people in the hospital are getting tested because they're prioritized? Can you also speak to whether these are each individual cases, again, of people who have traveled or if there's a spread among family members or in the community?
So to start with the second question, these are each individual cases of either folks who have traveled or have had exposures. We are continuing to see cases where it is challenging to easily identify the initial source of their illness. And for those who are in the hospital, certainly because we are prioritizing the hospitalized patients more, we are anticipating being able to see or identify positive cases of people who are hospitalized or congregate settings and healthcare workers so that we can get them addressed most readily.
Is there a delayed time? Is there a delayed time in the testing? So when you hear about these new positive cases, how long ago were those people tested? How long ago were they showing symptoms? And can you do anything? If there is a delay, can you address what's being done about that?
For these prioritized cases, our Rhode Island Department of Health State Health Laboratories is expediting the testing for those prioritized cases. So from the time it arrives at the lab to the time the test is run, it's for sure less than 24 hours, if not sooner. It's the process of getting to the lab and getting the swabs obtained that we're supporting them in obtaining.
It would just be somebody, the new cases, were they tested yesterday or the day before? Is that what you're saying?
Yes.
Kim, Governor, I know you're asking schools to stay physically closed for the next 2 weeks. What about childcare centers?
So at this point, we're working on a case-by-case basis is the short answer. So there are certain child care centers and home-based providers who are going to stay open, and they're working with the Department of Health on a case-by-case basis to get advice on how they could stay open safely. I will say I hear it that we need to figure out some kind of a babysitting structure because lots of parents are working from home, and at the same time we've shut down childcare. I don't yet have a concrete solution to offer, but we're working on it. I hope to have something better, a better answer in the next day or two. But in the meantime, a lot of the home care providers are still providing, and we are in daily contact with the YMCA, the Boys and Girls Club, and other child care providers to figure out who can stay open safely.
Question from this woman on the side of the room.
Hi, Governor. How are you?
Hi.
Question about education as well. Is the state taking into account the ELA learners and also the families that might not have Wi-Fi internet at home? I'm not sure how the distance learning is going to work that way.
So I will answer this question, and then I would like to give the commissioner a minute to talk about this. The question was, are we taking into account the needs of English language learners? And by the way, I would add to that kids with special needs, the developmentally disabled, and kids with IEPs. The answer is yes. We have our eye firmly on all those populations, and it'll be harder. It will be harder for those populations. As candidly, as well as for low-income people who may not have high-speed internet at home. So we're taking it into account, and over time, I think we'll be able to get everyone into a pretty good place to have adequate distance learning. We're not going to be ready to do that on day one, but we are every single one of those populations, we're working on work streams. By the way, that's exactly why I've done this for 2 weeks. We're going to take these 2 weeks and see how we do, learn what we learn, and then factor all of that in. I do want to be clear, though, not all distance learning is just technology. You could imagine, for example, a lot of these kids are going to a place to pick up their meals. You could go and pick up a homework assignment. You could go and pick up something to read it, and then figure out a way to do interaction with your teacher. So we're thinking really broadly and creatively, and the silver lining is at the end of this, we're going to be much better at distance learning and creative, innovative ways to deliver education than we are now. And again, I just want to thank everybody for their willingness to try. I want to give the commissioner a second to answer that.
Comisionada, hola,
En los
¿cómo
dos
estás?
idiomas.
Claro.
¿Será que nos puedes contestar esa pregunta en español? ¿Qué mensaje le mandas a aquellas familias que no dependen de Internet en sus casas, son personas más bien de bajos ingresos? Y también un mensaje a aquellas familias que tienen el inglés como su segundo idioma.
Sí, le voy a responder en español primero y después lo digo en inglés. Nosotros estamos trabajando con varias compañías para poder tener Wi-Fi en las casas de los niños. Hay una compañía que hoy mismo nos mandó a decir, Cox, que nos va a apoyar a nosotros en poder darle Wi-Fi a las familias que en este momento no tienen Internet. Eso es algo que estamos trabajando con todos los superintendentes para que nos digan qué necesitan, si computadoras, si Wi-Fi, qué necesitan las familias para nosotros poder proveer y trabajar con diferentes compañías para poder ayudarlo. Eso es sumamente importante. Lo otro es que las lecciones que se dan durante los días escolar se van a llevar a cabo a través del Internet. Para los niños pequeños van a haber panfletos, van a haber tareas, van a haber diferentes maneras de comunicarse y llevar a cabo, impartir la docencia que se estaba dando. No va a ser igual, por supuesto, pero nosotros estamos trabajando bien fuerte con los superintendentes, los principales, los maestros, para que eso continúe y se lleve a cabo. También en la página de nosotros tenemos una... Al final, si la ven al fondo, hay un botón donde los padres pueden ir y hay recursos para los padres en inglés y en español, de lugares donde hay libros en varios idiomas que los padres pueden utilizar y también programas que pueden utilizar en varios idiomas. Por favor, vayan a esa página. So I want to start by thanking the superintendents, principals, our teachers, the RIDE staff for working really hard. This has been a lot of work on everyone's part to ensure that we are ready to support our students come next week as we are building these plans. And the question that was asked is about our multilingual learners and our differently able students. We are going to continue to support the students as best we can. They are our priority as well. It is not going to be the same as in the classroom, but there are measures being taken for us to be able to do that. In terms of internet access and Wi-Fi, we are working with different companies that will help us get some of the Wi-Fi that's not available presently in homes. For example, Cox reached out to us today. They are going to support us in getting computers as well as Wi-Fi into the homes. And we're working with the superintendents closely. RIDE staff has been assigned to them so that they can tell us what their technology needs are as well as other needs.
So, Commissioner, is this going to set back the turnaround in the Providence schools, do you expect?
Well, no, because we're doing what we have to do instructionally, and we're carrying out the things that we have to do to be able to put a plan in place and move forward. So is it going to be a glitch for all of us in the state? Absolutely. But it's not going to stop us from doing what we have to do, because as you have seen, the governor has taken swift action in keeping the safety, the well-being, as well as the educational needs of our students in the forefront.
Are you telling private schools to close for 2 more weeks too?
Am I?
Governor,
Just want to make sure.
they'll follow you.
I would say that she has her hands full with the public schools. I would say that we don't think it's safe to be opening schools and having children go to school. You have everyone, the White House, the CDC, every governor, every health expert saying no crowds of more than 10 people. So that means you can't go to school safely. So they ought to be doing the same thing, which is figure out a way to do distance learning.
Commissioner, is there any concern that not every agency is going to meet tomorrow's deadline? I believe the department told my colleague Steph Machado yesterday only about half of the local education agencies had submitted their distance learning plans.
So we have received quite a few today, so we're pretty excited about that. There are a few that have not submitted, but we're working very closely with them, and they do have until tomorrow. So I want to give superintendents the opportunity, and we are also sharing plans that we think that are strong plans so that they can use those as models. La pregunta es que si los superintendentes van a tener los planes listos para mañana. Esperamos que sí. Muchos de ellos sometieron hoy y es importante que le demos la oportunidad. Ellos tienen alguien con quien trabajar en nuestro departamento que lo va a apoyar a ellos para poder desarrollar ese plan. Eso es sumamente importante para nosotros.
Comisionada, ¿qué mensaje también le mandas a los profesores? Hablé con algunos, están como decimos en español, como una gallina sin cabeza corriendo. Están un poco preocupados. ¿Crees que van a estar preparados para hacer este tipo de educación empezando el lunes?
Bueno, sí, es verdad que están algunos preocupados, pero lo que le digo a los profesores y los maestros es que nosotros tenemos el bienestar de ellos en mente y de los niños, que por favor no se preocupen, que nosotros estamos aquí para apoyarlos y también vamos a darle una mano, ¿verdad? Porque esta es la primera vez que esto se ha hecho. Esto es algo que no se ha hecho en ningún sitio en los Estados Unidos. Por lo tanto, nosotros estamos aquí para apoyarlo. The question is that she asked that some teachers are feeling anxious about the whole situation and whether they'll be ready for Monday. The way I answered that was that, this is the first time we're doing this. But we're here to support, but we have made it a priority to have their well-being and safety met, as well as the students' educational needs. So we're here to support. This is the first time that we are doing this. I'm sure that there will be areas that we will improve upon, but we're a team. We're getting this done together. That's the only way that we're going to be successful.
Commissioner, I know this is 2 weeks for now, but maybe you or the governor, is there any sense that students will actually get to go back to school 2 weeks from after April 3rd?
It's unlikely, but I am not at this point going to attempt to put an end date on. It would be dishonest of me to tell the people of Rhode Island that we know the date by which this will be over. So we're taking this a day at a time. In the case of schools, 2 weeks at a time. My most honest answer is I think it's very unlikely, but we're going to get through the next 2 weeks. And also some of it depends on how well we're doing with the distance learning. The commissioner, God bless the commissioner, she's optimistic. She's going to put her back into it to make it work. And I hope to be pleasantly surprised at the end of 2 weeks that we're able to deliver an education to these students without having them all go in school.
Thank you, Governor.
All set? Thank you.
Do you want to do the last? Are there a couple questions?
There are still some here. We want to acknowledge the people who have written in so that we can continue to encourage that approach for our reporters. Elizabeth Graham of PBN asked, we've heard reports of at least one Rhode Islander who just returned from international travel and has flu-like symptoms. She was told today by health officials that there are no coronavirus tests available right now. Is there a shortage of tests in the state? If so, when do you expect more tests to arrive? This reiterates our focus right now on the prioritized populations to be able to best use the supplies for testing that we have available with that prioritized group. The work that the governor is doing, our congressional delegation, and all of us is tremendous in terms of making sure that we have adequate supplies for going forward to be able to expand testing beyond that. But in the meanwhile, it is important for everyone to know what they can do. If you have flu-like symptoms, whether or not you have traveled, but certainly if you have, being able to stay at home, to recover safely there, and call your healthcare provider if there are concerns for more severe illness is the same treatment, whether or not it's COVID-19 or the flu or anything else. That makes the biggest difference to reduce the spread of illness. Michelle Smith of AP asked, what do you need most from the federal government? And it continues to be the supplies that we have been mentioning. We have people who have been put in place who are ready. We have the setup that's in place thanks to the capacity that's been expanded with the governor's leadership, and we need the supplies that we are in constant communication with the federal government about, as well as the personal protective equipment. Also, we have a question from Tara from WPRO. What about the homeless population? This is a critical population among other vulnerable populations that we are focusing on. We are working with our social service agencies throughout the state to address and respond to their needs specifically. Another question is, how are food trucks being handled? We are allowing and supporting food trucks to continue their service, given that we have stopped dine-in service and food trucks do not have that but allow for delivery. We are continuing to emphasize the importance of avoiding crowds and only allowing for essential needs to be addressed. So I'm going to stop there.
Thank you.
Thank you, everyone.
Thank you, guys. See you tomorrow.
All right, that wraps up the governor's news conference. A lot of news there coming today. And just before the governor spoke, we had the president gave a briefing at the White House. Now, we've been taking notes. Let's recap it. By the way, since we went to those two briefings, we've had a lot of news, including a shutdown of the stock market for 15 minutes. Because the S&P dropped 7%, the triggers went in and they stopped trading on Wall Street. But put the numbers up, guys. From what I understand, that's back in business now. We almost had a 2,000-point drop today, and that is severely now approaching the halfway point. Keep in mind, we're at 29,000 at the high. We're down to 19, and as we work our way toward the midway point. We're down 1,800 with trading resumed now, holding at 19,413 on the Dow. That's after a 15-minute freeze. Also, while we were in that news conference, all of the automakers, all of them in the U.S., have announced that they are stopping production in all of their plants. Stopping production in all of their plants for at least 2 weeks. So the market is going to need time to react to that. All right, let's recap. From the president first. He has activated the Defense Production Act. That means the government is now authorized to take over or direct factories to start making things that we needed in emergency. So if there's a factory that can make respirators or ventilators, they're going to be ordered to do that, provided they can do that, the Defense Production Act. He has also ordered HUD, Housing and Urban Development, not to foreclose on anybody for at least the next 30 days and not to evict anybody for the next 30 days. We are getting 500,000 masks from the Italians. They're shipping them in. They have a surplus there. We need them here. The president also said he's coming back later today to tell us about news from the FDA. Now, that's the Food and Drug Administration. What it is, we don't know. He said we're making progress on a vaccine, but that could be a year out. But he's got some separate news on the FDA. All right, those are the big things from the president today so far. Keep in mind he's coming back. Now to Governor Raimondo. Schools are closed this week, and they're going to stay closed till April 3rd. So the balance of this week and then 2 more weeks, schools are closed April 3rd. This is not time off. This is not an extension of the vacation. Teachers and the students have been told you have to do your work by a computer. Now, the plans to do this are supposed to be submitted tomorrow. Monday, we start. And she's advising parents to set a space in your house aside, because the kids have to sit there as if they were in class and look at the computer and do the best they can. She said this is going to be a learning experience for all of us, but we are on distance learning or computer learning from this point forth, starting Monday, actually, for the next 2 weeks, and we'll see how long it goes for that. Also, with regard to medical or telehealth calls. This is where you call your doctor, and instead of seeing him in person, you get the diagnosis over the phone or maybe by video chat. She has ordered all of the insurance companies to pay for that, just as if it was an in-person visit. So telehealth phone calls must be paid for. With regard to utilities, she has directed the utilities, those are regulated by the state, gas, heat, electric, water, sewage. You can't shut anybody off for non-payment of a bill for the next 30 days. Now, that doesn't mean that they're not going to send you a bill and they're not going to tack on late fees. We didn't get that far. She just said they cannot shut you off and they cannot go to a collection agency for at least a foreseeable future. She also advised if you have the money, pay your bill. Now, while we're in that area on bills, the state income taxes are coming due on the 15th of April. The federal government has said file on time. File your income tax on time. But if you owe Uncle Sam money, you're getting 90 days to pay it. You don't have to send the check in. It's very important. Rhode Island has not gone that far. They have yet to tell us if April 15th the state wants any taxes due. They may give us a reprieve or they may not. Right now, file your taxes for April 15th. Plan on writing the check to the state of Rhode Island if you owe, and if that changes, we will let you know. Schools were the big one. The Catholic schools are all following, including St. Ray's. Some charitable funds have set up money for those who are in an emergency. As you know, there are 3 things pending. Small Business Association says there's money available for restaurants and other businesses that find themselves in a lurch, up to $2 million. If you qualify, you have to file online. Congress is today tackling an $800 billion package to get money in the system right away. This has to do with public transit and food stamps. And then there's a separate $1 trillion package that's under consideration. It's supposed to be fast-tracked, and that includes maybe $1,000 for every individual American or household. And you get a check in April. But don't go running to the mailbox just yet. That is all in the pipeline. I think we've covered it. A lot of news today, but once again, the schools in Rhode Island closed for the next 2 days. The president is coming back later this afternoon with news from the FDA. That's the very latest. Now back to your regular programming. For NBC 10, I'm Gene Valicenti.